All right, what's up, guys? Welcome to Diabetes Talk. I'm your host, Charlie O'Connell, and we are here to talk about diabetes and pregnancy today. Guys, this is such an important topic for so many people living around the world. Our goal tonight is to share with you some very practical information about what are the actual special conditions and special considerations that have to be taken into and accounted for if you're a person living with diabetes and you want to have a successful pregnancy, and also explaining what actually is gestational diabetes, which is a form of diabetes that occurs in women during pregnancy. And of course, we want to answer all of your questions. This is such an important topic, and guys, I'm going to jump right into it. And I'm going to start off with talking about type 1 diabetes in pregnancy. So, we have had several women come to our GLUCOSEZONE facility that have had either the desire or basically have had trouble getting pregnant, and they've been really concerned that their type 1 diabetes is going to be something that hinders or potentially puts their baby at risk. And I totally understand that can be an incredibly challenging and anxiety-filling position, because first off, any mother or any father for that matter is always going to want the best for their baby. And even the thought that something related to our bodies or something related to our condition could have a negative impact on the unborn child or on our newborn child can really be something that is scary. So the first thing that I want to communicate to you guys, and specifically to women with type 1 diabetes that either want to get pregnant or are having trouble getting pregnant, is you can do this, and thousands of women living with type 1 diabetes have had incredibly successful pregnancies. They have given birth to beautiful babies, and you are going to give birth to a beautiful baby. And I really mean that. And I want you to embrace that, because having a successful pregnancy certainly involves a spiritual, mental, emotional, and intellectual aspect, as well as, of course, a physical aspect. So that is the first thing. Please, if pregnancy is something that you see in your future or something that you and your partner are looking to achieve, you can totally do it. Now, having said that, let's acknowledge some of the things that women living with type 1 diabetes go through. So the first thing is, and I have only become aware of this because of the work that we do, and the women that have come to the GLUCOSEZONE facility have shared with us some of the things that, quite frankly, are really unfair. And one of those things is, many times healthcare providers, either unknowingly or with the best intentions in mind, really scare women living with type 1 diabetes and cause them to be fearful that fluctuations in their glucose levels can cause damage to their unborn child, and basically really tell the woman that they have to have tight control of their diabetes before getting pregnant. Now, of course that is true. The tighter your control with your type 1 diabetes, the less likely the chance or risk of a complication associated with high or fluctuating glucose levels. But having said that, you can definitely drive yourself crazy if you are a person living with type 1 diabetes. The notion of keeping your blood glucose levels at a perfect range and your glucose levels never going above 130 or never going below 80, quite frankly, that's just totally unrealistic. And I want to communicate to you that there are, again, thousands of women living with type 1 diabetes that have had successful pregnancies, and they definitely have not been able to maintain that perfect control. And we've had several women that have come through the GLUCOSEZONE facility that basically can attest to that. So, managing your diabetes is tough. If you add that additional stress of anxiety about what your fluctuating glucose levels could do to your unborn baby, that can be really, really tough. So let's actually explain exactly what's going on here, okay? The first thing is, let's understand why there's concern. So the bottom line is elevated blood sugar molecules and ketones can pass through the placenta to a developing fetus and can cause birth defects. That is true. So let's just acknowledge it, that that is a possibility. All right? The key here is really three things. The first thing is being smart about your food and nutrition. That is like the number one thing, because by being smart with your food and nutrition, you can definitely eliminate the large fluctuations in glucose levels. It's almost impossible to have steady state glucose levels all the time, but certainly by eating right, by focusing on vitamins, minerals, and nutrients, you can go a long way to eliminating large fluctuations in glucose levels. The second thing is making sure that you're exercising. And obviously, guys, we here at GlucoSezone, we are a company that's focused. We want to be your partner in fitness and diabetes. So obviously, we are going to be espousing the benefits of exercise, but in this case, this really, really is true, and it really, really is an incredibly important thing. The more you exercise, the more muscle mass you create in your body, the more sensitive you are going to be to insulin, and the more natural space you are going to create in your own body for the healthy storage of sugar and the healthy storage of glucose molecules and the healthy storage of glycogen. And remember, what is glycogen? Glycogen is the form that glucose takes when it is stored in your liver and in your muscles. Okay? So, generally speaking, some target blood glucose ranges for in terms of pre-pregnancy is to limit glucose excursions to a level of 155 1 to 2 hours after eating. And that is actually a really, really practical recommendation, okay? And that's something that is achievable. So I'm not communicating, and I really actually think that it's unrealistic to communicate to women with type 1 diabetes that, you know, your blood sugar should never go above 125. 155, that's another story. That is something that for the most part is achievable, and there are things that you can do if your glucose level does go above 155. There are things that you can do to bring that glucose level down. Certainly aerobic lower body exercise would be a good example of that. Now, the next thing is getting your A1C to as close as 7 as possible. All of the research indicates that if you can keep your A1C at 7 or below, you dramatically reduce the risk of complications for yourself and complications for your unborn child. Okay? Now, having said that, an A1C of 7.0 is not a requirement for pregnancy with type 1 diabetes. And I say that very, very specifically because I have a GlucoSezone client who shared with me a really, really terrible story. And the story that she shared with me was years ago, she was considering getting pregnant, and her doctor had indicated to her that if her A1C was not below 7, it was unwise to get pregnant, and the doctor basically said to her, I don't recommend pursuing pregnancy if you cannot get your A1C below 7. So this woman who has lived with type 1 diabetes for over 25 years, she really, really embraced this incredibly frustrating struggle of eating right, pursuing exercise, and she just could not get her A1C below 7. And for 2 years, she went through this terrible anxiety of feeling like a failure, feeling like she was putting herself and her whole dream of having children at risk, until one day she got totally fed up. And to her credit, she let go of this judgment that herself and her doctor had really placed on, you can't get pregnant unless your A1C is below 7. And she basically just kind of threw that out the window. And guess what happened? Her and her husband were able to not only have one, but two beautiful, beautiful children that are now 10 and 12 years old. She never was able to get her A1C below 7, but she was able to have a successful pregnancy and give birth to two incredible children that are great, great, healthy kids today. So I share that story as an inspiration, really, to, yes, of course, you want to get your A1C as close to 7 as possible. Yes, of course, a healthy diet and nutrition and consistent exercise are going to be very, very important to lowering your medication needs and improving your sensitivity to insulin. But ultimately, guys, diabetes is a very, very challenging and complicated disease, and you need to listen to yourself. And if you have a dream, and if you have a passion, and if you basically, something's telling you inside your body that it's time for you to pursue pregnancy, you should do it, okay? And the best thing you can do is monitor your blood sugar levels frequently, be honest with yourself when your behavior is contributing to the problem, okay? And then also take it easy on yourself and understand that diabetes is an incredibly challenging and difficult disease to manage, all right? So that's kind of the motivational part here. Now, let's get down to some of the more facts about type 1 diabetes and pregnancy. So it is very important, anytime you're talking about diabetes, to acknowledge the risks and acknowledge the facts, okay? So some of the possible risks to both the mother and the baby, if blood glucose levels are consistently and chronically high during pregnancy, include a premature delivery, a miscarriage, birth defects, something called macrosomia, which basically, macrosomia means large baby, okay? A low blood glucose at birth, which is an interesting side effect, hypoglycemia at birth, prolonged jaundice, and respiratory distress system, which means difficulty of breathing. Those are the risks for the baby if the potential risk for a baby if a woman living with diabetes has chronically high blood sugar levels throughout the pregnancy, okay? In terms of the risk for the mother, there is certainly a risk for the worsening of diabetic eye problems, okay, which is diabetic retinopathy. There's a worsening of diabetic kidney problems, infections. There's something called preeclampsia. Now, preeclampsia is one of the most dangerous and important things to understand when a woman is pregnant. The condition of preeclampsia is basically related to high blood pressure. And what occurs in preeclampsia is the woman all of a sudden experiences extreme high blood pressure. And it's actually, the blood pressure is so high that both the child and the mother are at risk for death if the baby is not delivered. And usually the baby is not delivered within 48 hours. So this is an extremely dangerous situation. It is something that should be constantly monitored. It is, again, preeclampsia is a condition of high blood pressure, but there's an increased risk for preeclampsia if a woman living with diabetes has chronically high blood glucose during the pregnancy. All right? Now, the most important thing that you can do ultimately is find a healthcare provider that you trust, that is willing to be in communication with you and answer all your questions, and basically somebody that you feel is in your corner. Okay? You need somebody that is there to support you, that is there to provide you with sound professional advice, not somebody there to judge you, not somebody to make you feel bad about having diabetes. Okay? And again, countless women who have had diabetes have developed healthy babies. Okay? And the key is really just paying attention to the various different metrics that indicate healthy diabetes and living a healthy life with diabetes, and basically being in communication with your doctor. All right? And hopefully that's information that women living with type 1 diabetes can use, they can feel inspired by, and I would really, really encourage you, reach out. There are amazing online support groups of women living with diabetes who have had successful pregnancies. All right? Now, let's now turn our attention to gestational diabetes. So gestational diabetes is a special form of diabetes that develops usually between the 24th and 28th week of a pregnancy. And the cause of gestational diabetes is the woman's body cannot produce enough insulin, okay, to keep up with the needs of the pregnancy. So let's break this down and understand what that means exactly. Insulin is an anabolic hormone. What anabolic means is it builds up. Okay? So it is a hormone used by your body to build up cells, and whether you're talking about muscle cells or fat tissue. Now, gestational diabetes occurs when the woman's body cannot produce enough insulin or use the insulin properly to keep up with the needs of the pregnancy. And the needs of the pregnancy fall into the category both of the mother and of the child. Now, generally speaking, this is very important to understand, a woman's body will become insulin resistant during pregnancy under normal conditions. But in gestational diabetes, the insulin resistance becomes much higher. So that's a really important thing to understand, is that when a woman becomes pregnant, insulin levels are going to go up under normal conditions. And the body is going to become a little bit naturally more resistant to insulin. Gestational diabetes, though, is when that resistance to insulin takes on a whole nother level. Okay? When that happens, when the woman's body cannot either generate enough insulin or has become resistant to the insulin, blood sugar levels start to build up in the blood. And that can be unhealthy for both the mother and the developing baby. Okay? Now, gestational diabetes usually occurs later in pregnancy. So birth defects are less commonly seen. It is a less common thing to see a birth defect as the direct result of gestational diabetes. Having said that, there is an increase in the risk of preeclampsia with women who have gestational diabetes. So that's very, very important to understand. And if you don't know what the term preeclampsia means, which I actually would be surprised for all the women that are watching this, find out what preeclampsia is. All right, now, large babies. So large babies are one of the basically risks, and it's called macrosomia. Okay, so large babies with increased, this is very interesting and it's something that's important to understand. Large babies with increased fat stores are the result in pregnancies with gestational diabetes because the infant is exposed to high maternal blood glucose levels, and the infant's pancreas is forced to make excess insulin that causes increased fat stores from the increased glucose. I'm going to say that again. Large babies with increased fat stores are the result, of pregnancies with gestational diabetes because the infant is exposed to high maternal blood sugar levels, and the infant's pancreas is forced to make excess insulin that causes an increase in fat stores from the increased glucose. And what's very, very interesting is that maternal insulin cannot cross through the placenta, but glucose can. So that's a very, very interesting thing, an important thing to understand. Any insulin used by the infant, even at the earliest stages of the pregnancy, is produced by the infant themselves. Okay? Which is a very, very interesting component of the entire pregnancy process, and it can help you understand what's going on. All right. Now, there are certain risks of birthing large babies that basically can result in difficult births, including shoulder dislocation, breathing issues, hypoglycemia, jaundice, and a need for cesarean birth. Okay? The other thing that's important to understand is that gestational diabetes is increased. The risk for developing gestational diabetes is increased if you are pregnant with multiple babies or you are overweight before becoming pregnant. So the one thing that I do want to encourage you is, and this is a recommendation for anybody, is that if you are planning on getting pregnant, the better shape you can be in, the healthier your eating habits can become, the less likely you are going to develop gestational diabetes. Now, having said that, some people develop gestational diabetes, some women develop gestational diabetes who are incredibly fit and eat incredibly well. So this again comes back to not judging yourself. Okay? Don't judge yourself when it comes to diabetes, when it comes to gestational diabetes. All right. Now, another interesting, important kind of statistic. 75% of women who develop gestational diabetes can manage the gestational diabetes through diet and exercise. So if you are diagnosed with gestational diabetes, I really want to encourage you, and hopefully you already are working with a healthcare provider that you trust and basically can provide you with the guidance that you need to either find a personal trainer, which I would definitely recommend. Find somebody in your area that is smart, professional, intelligent, and has experience working with people, working with women that have had gestational diabetes. All right? Now, women who develop gestational diabetes are more at risk and more likely to develop type 2 diabetes later in life. And basically, the more you can be physically active, especially after the pregnancy is over, the less and less the risk and the likelihood is going to be of developing type 2 diabetes later in life. All right? Okay, now, children, this is another important thing. Children, both male and female, born to mothers who have had gestational diabetes are at a greater risk of developing type 2 diabetes later in life. Now, the cause of that is not exactly known, but the statistics bear that out. Okay? So, to recap, if you are a woman living with type 1 diabetes, I want to encourage you, there's absolutely, it is possible, and thousands of women have had successful pregnancies and given birth to beautiful children. The key is being in control of what you can be in control of, being physically active, working with your healthcare provider, and basically finding a healthcare provider that you trust and that is going to be your partner, not going to be a judge or somebody who gives you anxiety. Okay? Target blood glucose levels for a woman living with type 1 diabetes before a pregnancy are basically 155 or below. Okay? And then actually during the pregnancy, Your goal is to have your glucose levels be as close to normal as possible 1 to 2 hours after eating. Okay? And generally speaking, getting your A1C as close to 7% as possible should be your goal. All right. Now, when it comes to gestational diabetes, to recap, gestational diabetes usually is diagnosed between the 24th and 28th week of pregnancy. Okay? Gestational diabetes is elevated blood sugar levels that develop during the pregnancy because the mother's body cannot make enough insulin to support the needs of the pregnancy. All right? Generally speaking, the vast majority of women who develop gestational diabetes can manage that gestational diabetes through proper eating, through diet and exercise. So I want to encourage you, if you have been diagnosed with gestational diabetes, work with your healthcare provider, take the necessary steps to increase your physical activity, be smart about the food you eat, and definitely be aware of other risk factors like preeclampsia, which is a truly serious condition that requires immediate medical attention. All right. And lastly, guys, just to reiterate, thousands of women have had successful pregnancies, given birth to beautiful children, women living with type 1 diabetes, women living with type 2 diabetes, and women who have developed gestational diabetes. Now, there have been a ton of questions coming through, and I want to answer a couple of them, and I'm sorry I haven't been ignoring your questions, but guys, this is such an important topic, okay, that I really did want to get through as much as possible. So, we just had a question come through, and the question's from CR33D195. I'm glad that you're here. Okay, I also want to say what's up to Instagram, YouTube, Facebook, the GLUCOSEZONE app. Guys, GLUCOSEZONE around the world. I love this community of people, okay? So the question is, if the baby is supposed to be big while having diabetes, but when my child is born, it ended up being small, what's the cause of that? All right, so here's the answer. Just because you are a person living with diabetes, or just because you've developed gestational diabetes, that does not mean necessarily that you are automatically going to have a large baby. And this is a great question to ask, because sometimes we hear things and we make the mistake of basically assuming that that one potential outcome is the only outcome that's possible. Or we assume that that one risk factor is going to develop into something really bad, okay? So without knowing anything else about your pregnancy, it's impossible for me to say, well, this is the reason why your baby, your child, then ended up being born small. But what's important to understand is that, yes, women who have gestational diabetes or women living with diabetes, there is an increased chance of having a large baby, or an increased risk of having a large baby, but that does not mean that that is automatically going to happen. And there are many causes, many reasons why a variety of things can happen during your pregnancy, can be the result, or basically that ultimately is the end result of your child. And what I would encourage you, all women and all fathers as well, is that having a child is the most amazing thing that's ever happened to me personally. My wife, we've been extremely lucky. My wife has given birth to 2 children, and both of them have been a very different experience. Ultimately, feeling blessed with however your child comes out. A child is a gift, and don't make the mistake of judging yourself, judging your decisions, judging your health conditions, okay? Don't put that pressure on yourself, because God would not have chosen you to have that baby, okay? God would not have blessed you with that opportunity if he didn't want you to have this to happen. And really on that note, I think that's a great way to end. Of course, guys, we want to answer all of your questions. Our goal is to be a partner in diabetes and fitness. We want to help you reach your fitness goals, and I certainly want to encourage you, use GlucoSezone as you see fit to help you reach your diabetes and fitness goals and to successfully reach, okay, the exercise requirements of living with diabetes, getting your body ready for a pregnancy, and ultimately living a healthy and active lifestyle during a pregnancy. And on that note, we're going to sign off. Thank you so much, guys. I cannot wait to join you again in Diabetes Talk.